Hey YouTube, this is going to be my first video, possibly my only video. I just wanted to talk about my experience with Mirena and excuse this video for being a first and probably not as good as many other videos. But I really wanted to put this out there because I know I wanted to see as many videos about Mirena as possible before I had mine inserted, just because of the ones that are out there sort of make you want to see other ones, because some of them are good experiences and some of them are bad experiences. So mine, I'm going to say right now, has been a great experience. There has been some bad, but for the most part, I'm extremely thrilled, and I would definitely do it again. In fact, I will do it again in 5 years. Yeah. So, okay, so to start out, I do have some notes here just because I don't want to babble on too long. Okay, so I go in and I had taken, I had not eaten that morning. I just had like probably a big cup of water just because I usually drink a lot of water. And I took my normal medications that I always take in the morning. And I took 3 Advil. And I went in and I had the procedure done, and it was quick. The part where none of it feels like much of anything to me. I've never had any children, and I know that's an iffy situation. It might be part of why I have had this problem that I did have. But when they inserted it through the cervix, that part where everyone talks about it just being like the worst pain they've ever had in their life. For me, it was one of the worst pains I've ever had in my life. I have a herniated disc. Okay, so that's a good example. I have a herniated disc. I have sciatica from it. Let's compare it with that. Okay, it might compare to sciatica pain, but it's super brief. And if I had known what labor felt like, it might feel like 1 second or 5 seconds or 10 seconds of labor. I don't know. So that's that. My problem was when they push the button, which makes, I think this is how it works, which flips the arms out and puts it in place in your uterus, and then they pull the inserting tube out. That's where I had the problem, not when they were pulling it out. It was just after the arms were opened up. It just felt like they were too long for my uterus, and it was like just real severe pain. That may have felt more like labor pains. I don't know because I've never had labor pains, or been pregnant. So. Let's see, I have been on birth control pills since I was 16, and decided that I needed to get off of them because I did quit smoking, but I still unfortunately cannot get off of nicotine replacement therapy, and I feel like that is I've talked to my doctors, and they say even though smoking is supposedly the risk and nicotine isn't, that really nicotine is a risk factor on strokes. I'm sorry, my phone will not stay in place. So they said it probably was a risk factor, and I also have periodically, recently I've been having high blood pressure, not high, slightly elevated blood pressure, and so because of that, with birth control, it just can cause a higher risk for stroke and heart attack. After the age of 35, you're at a higher risk, and I just didn't, that's like the last thing I want to do is be like, oh, I had to keep taking birth control pills. Like, there's so many other options. And then have a stroke at age 44, or have a heart attack at age 44. I have a friend who had a stroke from birth control pills at age 36. She didn't know that she had a minor heart defect, and she was taking birth control pills. So it was the combination of those two things. And thank God it was just a minor stroke for her. So, yeah, I didn't want to be that person. So, what I on my notes, I said, if you can handle a large tattoo, like I have like a palm size tattoo, and I'm a 5'7.5" girl, so my palms are fairly large. You know, not like you have anything to compare it to, but palm size tattoo on my back, in the middle of my upper back, and that insertion part of the pain definitely is. If you can handle a tattoo like that, you should be able to handle that for sure, because it's brief. But I really haven't heard of anyone. They say that they have cramps after they get it put in, but they don't say that they're like in bed for 3 days. And I pretty much was. I could not leave the doctor's office. When I couldn't leave. I didn't feel comfortable driving. I was dizzied, I guess, by the pain. It was probably also because I did not eat. I highly recommend that you eat something before you get this procedure. That was really stupid. I never eat in the morning. I'm not hungry in the morning at all. It kind of grosses me out. But had I known better, I would have definitely had like a breakfast, like a real breakfast that morning, because they gave me juice, which I would never normally drink. I don't do simple carbs. But they gave me a juice, and they gave me some like saltines, and that did make me feel less dizzy fairly fast. But I was still in excruciating pain. Like I said, I had taken 3 Advil before I went in. As soon as they realized I was in so much pain, they gave me 2 extra strength Tylenol. And I guess by the time the Tylenol kicked in, it was probably 45 minutes or an hour later, I felt safe enough to drive. They did write me a prescription for 20 Tylenol 3s. And I think I only took 10 of them. I took them 5 doses, 2 pills each time to get through the 3 days after the procedure. It was really more, I probably only took them the first day after, the day of and the day after. And then I was down to Advil. And, but even with the Advil, I was having, I'm not gonna use Tylenol 3 unless I'm in like really deathly pain. So I didn't, I just dealt with the pain. I used a heating pad for those 3 days, and just dealt with it. And I can imagine that it might have felt like labor pains, because it was sort of like a coming and going. I think it was my body like just being like, why did you stick these 2 things in my fallopian tubes? And I think it was kind of pushing them apart. I'm not really sure. I mean, I'm a large built woman. I mean, I have a large frame, and I am 5'7" and a half, but I do sort of, that's just my gut feeling, that's what was going on, is it was just too tight in there. The arms were slightly too long. I am glad that I got a Mirena. I hate to say that it was worth the pain, but because I don't know if I would say that when I was going through the pain, but I think it may have been worth the pain, because it's a 5-year deal versus the Skyla is 3 years. I know it's smaller, but I also would rather have it be, I guess, bigger, because I feel like Skyla might be more likely to sort of dislodge and float around your body. I'd rather have something sort of larger in there, just in case it is floating around. It'll be more obvious, hopefully. I did have my period about 4 days after it was inserted, and it was longer than usual. I usually have about 7 or 8 day periods. The last 2 days are just sort of spotting. The second through the 5th day are usually like I need a towel when I'm sleeping, no matter what other kind of period protection I'm wearing or using. This period, that first period, was about 11 days long, but it was very light for me. I mean, some people with light periods might have called it like medium. But it was super light for me. So I was thrilled. I didn't mind it one bit. I didn't mind having it. I didn't have any PMS. And then I didn't have a period for about a month. But it's not like to any specific, I can't count the days yet, but I am using a period tracker app called P Tracker. someone suggested on another Mirena app because they wanted to try to figure out when their periods were actually going to come. And I actually like to be able to track when I'm spotting, because straight up, I have spotted every single day for 3.5 months. So it was good to have that. My second period was a 3-day period, and it was ultralight also, which was like heaven, no PMS. It was perfect. Definitely why I got it. Part of why I got it. One of the many reasons. It looks like on my period tracker that I am getting it about every month, and the period tracker seems to be getting fairly accurate as to when I'm going to get my period. The last one was actually within like 2 days of when it said it was going to come. So that was good. And I will say, I was really excited about the 3-day period. I can't say that they've all been 3-day periods. I think I had probably a 5-day period, my most recent period, but it was still light, and no PMS, which that's what I'm all about. That's what I'm doing this for. I was on Seasonal before this, which is where you get your period every 3 months. And I did not have PMS when I was using Seasonal, but when I was using many years before that, I was using monthly birth control, where you get your period every month. And I had terrible PMS, but most of the month. I mean, 2 weeks before and the week during, leaves you 1 week without PMS. It's terrible. So I was happy to find Seasonal, and I'm, in my situation, I definitely need the Mirena. If you have any trouble remembering medication, definitely do the Mirena. I did want to say, I did already talk about the discharge, but there's a few more things about that. I have one thing to celebrate, which is yesterday and today, I have not been spotting. That would be the first 2 days since the day it was inserted that I have not had spotting. So, so I've had to wear a pad basically every day. Since I got it. You could wear panty liners. You'd have to change them more frequently. It seems like a lot of people have the spotting until your body sort of like just gets used to it. So I'm celebrating that, and I wanted to talk about that spotting. For those of you, like if you had the spotting that I had, and you were younger, it depends on who your partner is or who your partners are. You're more likely to get the pelvic inflammatory disease from the Mirena if you have multiple partners. So it's not actually recommended for people with multiple partners. But I am not going to judge you. You go do whatever you want. But I'm talking about sex here. Your sex life. For me, I've been in past relationships in my younger years where if it didn't happen, like at the moment it needed to happen, it wasn't going to happen. Don't kill the mood kind of thing. But, for us, it's not a problem for when we're in the mood, when the moment arises for me to jump in the shower for 1 minute to make myself feel fresh and move along. If you will probably feel very, you're not going to feel real clean. I have no hair loss. I haven't had any extra acne. I do have acne, but I don't have any extra acne or any changes in my acne. And there were a whole bunch of other side effects, but what I can say is I haven't had any of them. I've been on a strict weight loss diet for about 6 months, and I did not notice a change in my ability to lose weight after I got the Mirena. I know that's another, people say they can't lose weight. Has not been a problem for me. I don't have cramps during my periods, and my cramps have always been terrible during my periods, and I think a lot of people who get Mirena do have worse cramps during their periods at first. I don't remember having any cramps. In fact, I'm just blatantly surprised when my period happens, which is not always, it's never a good thing, but luckily it's pretty light. My mood's the same. I haven't changed. And that's it. So good luck with whatever your birth control decisions are, and all of your family planning needs, and all of your lives and your futures and your families. Take care.